If you're over 60, please hear this. A simple piece of fruit, something you've probably eaten your whole life, could quietly be raising your risk of stroke while you sleep. Imagine going to bed feeling perfectly fine, only to wake up unable to speak, stand, or even move one side of your body. No symptoms, no warning at all. As a brain doctor, I've seen this terrifying scenario unfold far too many times, and it wasn't due to smoking or junk food, it was from seemingly healthy fruit. What appears innocent can become surprisingly risky as your body changes with age. After 60, your kidneys, liver, blood vessels, and brain process sugar, potassium, and acid differently, while factors like medications, slower circulation, and nighttime dehydration can exacerbate the problem, turning an everyday fruit into a silent threat. This crucial information is why I want to guide you through 6 common fruits that may be doing more harm than good, particularly if consumed at the wrong time or in the wrong combination. If protecting your brain and heart with science-backed insights resonates with you, I encourage you to subscribe to Health 365 and comment below with yes. You might be truly astonished by the fruits on this list and the powerful reasons behind their hidden dangers. Let's begin with bananas, those soft, sweet, and friendly fruits we've enjoyed since childhood. They are easy to digest, packed with nutrients, and feel like a safe snack. However, for those over 60, consuming bananas, especially overripe ones, might not be as harmless as you imagine. As bananas ripen, their starches convert into sugar, making them sweeter but simultaneously increasing their glycemic index. An overripe banana can cause a rapid spike in blood sugar, which is a significant concern for seniors. Our body's ability to manage potassium, blood sugar, and blood pressure naturally declines with age. Kidneys slow down, insulin sensitivity wanes, and blood vessels stiffen. This means a seemingly innocent, mushy, speckled banana could acutely elevate blood sugar, increase blood pressure, and even affect heart rhythm due to its high potassium content. Consider Margaret, a 76-year-old retired librarian who routinely started her day with 1 or 2 overripe bananas, often in a smoothie, believing it was a healthy choice. One morning, she awoke dizzy with slurred speech and was rushed to the ER, where she was diagnosed with a mild ischemic stroke. Doctors noted her blood pressure had spiked and potassium levels were high overnight, explaining that the combination of sugar, potassium, and her morning dehydration created a perfect storm. After this incident, Margaret wisely opted for smaller, greener bananas, consumed only after drinking water and having some protein, which notably improved her energy and stabilized her blood pressure. The key takeaway here is that while bananas are not inherently bad, overripe ones, especially in large quantities or on an empty stomach, can silently push vulnerable seniors toward a stroke. This hidden danger, unfortunately, isn't limited to just bananas. Next, we turn our attention to grapes, tiny, sweet, and refreshing, but they harbor a surprisingly high sugar load that could pose an even greater risk. These innocuous-looking fruits, often served with meals or as snacks, contain a significant amount of pure sugar in a small package. Seedless and extra sweet varieties, prevalent in most grocery stores, are particularly dense with glucose and fructose. Consuming a handful, especially on an empty stomach, sends this sugar rapidly into your bloodstream. For older adults whose insulin response is slower and blood vessels are more delicate, such a sudden sugar spike does more than provide a quick energy burst. It stresses the brain and heart in ways that may go unnoticed. Within those fragile vessels, sugar triggers tiny inflammatory responses, microscopic swelling and damage, prompting the body to form clots. Initially small and undetectable, these clots can accumulate day after day, increasing the risk until one morning your balance is off or your words are difficult to form. This was the unsettling reality for Mrs. Evelyn Morris, a sharp, independent 79-year-old retired music teacher who cherished her mid-morning routine of reading with a bowl of red grapes, sometimes consuming 2 cups without a second thought. One day, while writing a birthday card, her hand trembled, and moments later, she struggled to spell congratulations. Her daughter's prompt action led to an ER visit and a diagnosis of a mini-stroke or transient ischemic attack. Her blood sugar was elevated, and tests revealed low-grade inflammation and pre-diabetic markers she was unaware of. Despite her efforts to eat healthily, even fruit, when consumed inappropriately, can quietly become dangerous. My recommendation for patients is never to eat grapes on an empty stomach or by the bowl. Instead, enjoy a small handful, always paired with almonds or a slice of cheese to slow sugar absorption, and specifically avoid grapes at night, as stable blood flow is crucial during sleep, not sugar spikes. If you are diabetic or on blood pressure medication, it's essential to consult your doctor before making grapes a regular part of your diet. Now, if grapes seem surprising, prepare to hear about pineapple, that sweet tropical bite often enjoyed after dinner. This fruit could quietly interfere with your brain while you sleep. For older adults, especially those on medications or experiencing circulation issues, pineapple can create a silent storm, increasing stroke risk. Pineapple contains bromelain, a natural enzyme. While small amounts might aid digestion, larger quantities or when combined with blood thinners or clotting-affecting medications, bromelain can disrupt your body's natural clotting process, essentially making your blood too thin. This poses a serious danger. Brain bleeds, a severe form of stroke with a much harder recovery. Beyond bromelain, pineapple's high sugar content and glycemic index mean it rapidly floods your bloodstream with sugar. Consuming it after dinner, when your body is winding down, allows this sugar to circulate, stressing your blood vessels throughout the night. Furthermore, pineapple is remarkably acidic, which can trigger silent acid reflux at night in many older adults, even without noticeable burning pain. This reflux can cause minute amounts of stomach acid to enter your airway during sleep, reducing oxygen to your brain, a type of low oxygen stress directly linked to dangerous early morning strokes. Consider the experience of Mrs. Clara Hughes, a 77-year-old retired choir director who, instead of cake or cookies, indulged in a few slices of fresh pineapple after dinner every night, believing she was making a healthy choice. One morning, she awoke dizzy, struggled to walk straight, and her speech was slurred. Hospital scans confirmed a small posterior stroke, impacting her balance and memory. Her blood sugar was high, platelet levels were irregular, and tests indicated reflux-induced oxygen drops during sleep. It wasn't a single cause, but a dangerous combination of sugar, acid, and bromelain, all from the fruit she trusted. My advice is to enjoy pineapple earlier in the day, in small portions, and never on an empty stomach. Crucially, avoid combining it with blood-thinning medications unless your doctor explicitly approves. And most importantly, never eat pineapple before bed, as your brain requires restful, steady oxygen, not unwelcome surprises, because even something that tastes light and healthy can become a silent risk, especially overnight. If pineapple's risks are surprising, consider watermelon, a fruit widely thought of as hydrating, yet it might be quietly dehydrating your brain. This summer favorite, light, juicy, refreshing, and 90% water, is often perceived as the perfect way to stay hydrated. However, for older adults, watermelon can be deceptively misleading. Many people don't realize that watermelon functions as a natural diuretic, increasing urination. This seemingly harmless effect becomes significant when you consider that many seniors are already taking water pills or blood pressure medications that also remove fluid from the body. Consuming a large serving of watermelon in the evening, especially after medication, can set you up for overnight dehydration where your body loses excessive fluid silently as you sleep. Dehydration thickens your blood, making it flow more slowly, much like syrup. This thickened blood elevates the risk of clot formation, particularly in narrow, aging arteries. Combine this with naturally lower blood pressure during sleep, and you have the ideal conditions for a silent stroke. Take Mr. Howard Lynn, an 82-year-old retired postal worker who diligently walked daily, avoided sweets, and strove to stay healthy. A regular habit was enjoying 2 or 3 large slices of watermelon after dinner to cool down and stay hydrated. One morning, he awoke dizzy and collapsed when trying to stand. At the ER, his blood pressure was dangerously low, and labs showed signs of dehydration and thickened blood. A scan confirmed a small ischemic stroke, likely from a clot forming overnight as his blood flow had slowed too much. Howard had no idea that the watermelon, which he viewed as healthy, was actively drawing water out of his system, not replacing it, and in combination with his diuretic medication, it dangerously tipped the balance. The crucial advice here is to enjoy watermelon earlier in the day and in moderation. If you're on water pills, consult your doctor first. Pair it with electrolytes like a pinch of salt or a sip of coconut water to help your body retain hydration, and strictly avoid eating it at night. Don't ignore symptoms like a dry mouth, morning dizziness, or feeling off balance upon waking. These are your body's whispers that something isn't right. Watermelon might be surprising, but what about oranges? A fruit lauded for its vitamin C and heart health benefits. Could it really interact dangerously with your medications? A glass of orange juice with breakfast or a sliced orange might seem innocent enough. However, many seniors are unaware that oranges, particularly orange juice, can quietly interfere with their medications. While one glass of orange juice can indeed spike blood sugar, the greater concern lies in natural compounds called furanocoumarins found in citrus fruits like oranges, grapefruits, and Seville oranges. These compounds interfere with liver enzymes, specifically those that process many common medications. This interference can cause your body to retain too much of a drug or prevent it from being processed at all. Consequently, a blood pressure medication taken for years could suddenly become too potent, leading to dangerously low blood pressure. A statin for cholesterol could accumulate, causing muscle inflammation or brain fog. Or, a blood thinner might cease functioning properly, leaving your blood unstable and increasing stroke risk without warning. This isn't mere theory. I've witnessed it firsthand with Mr. Elbert Bryant, a 79-year-old retired bus driver who cherished his morning ritual of fresh squeezed orange juice with his heart and cholesterol medications, calling it sunshine in a glass. Over time, he developed dizziness, lightheadedness when standing, and occasional confusion. One day he collapsed, and doctors found he'd suffered a minor ischemic stroke, with blood tests showing dangerously elevated drug levels despite no change in his dosages. The culprit was his daily orange juice habit. The citrus compounds had impaired his liver's ability to break down medications, silently overloading his system. My recommendation to older patients is to limit or completely avoid orange juice if taking medications such as statins, calcium channel blockers, or blood thinners. Do not mix citrus with your pills, and if unsure, always consult your doctor. If you love citrus flavor, a small splash of lemon or lime in water offers fewer interactions. At this stage of life, even an orange can subtly upset your body's balance without you realizing it. If that makes you rethink your morning routine, wait until you hear about mangoes, a sweet tropical treat that could be raising your blood sugar and slowing your liver simultaneously. Soft, juicy, and naturally sweet, a mango feels like a tropical reward, a fruit seemingly too delicious to be dangerous. Yet if you're over 60, especially if you take medications for blood pressure, heart rhythm, or cholesterol, mangoes might be causing more harm than good. Mangoes are among the highest sugar fruits, with just 1 cup of ripe mango containing nearly 45 grams of natural sugar, more than a donut. Consider what this does to an aging body. Your insulin response is slower and blood vessels are more fragile. A sudden sugar spike generates inflammation within your arteries, particularly those supplying the brain. This inflammation can create tiny cracks in vessel walls, which the body attempts to repair by forming blood clots. While this might not be a major issue for a younger individual, in a senior with narrowed arteries, such a clot can easily obstruct blood flow to the brain, leading to a stroke. Mangoes also contain mangiferine, a compound that sounds harmless, but can interfere with your liver's ability to process medications, especially those relying on the cytochrome P450 enzyme system, which includes many common heart, cholesterol, and blood pressure drugs. Instead of your body safely clearing these medications, they build up in your system. Initially, you won't feel it, but eventually you might experience dizziness, weakness, or worse, a sudden blood pressure crash, or an unexpected change in heart rhythm. Take Mr. William Booker, an 83-year-old retired firefighter who aimed to eat healthily by substituting cookies with dried mango slices each afternoon. He was also on medication for atrial fibrillation and high blood pressure. After a few weeks, he began waking up lightheaded, and one morning he collapsed, his wife noticing the left side of his face droopy. Hospital scans revealed a mild ischemic stroke. Blood tests showed abnormally high medication levels despite correct dosages, all because his liver couldn't properly process the drugs due to daily mango consumption. My advice is that if you enjoy mango, consume only a few bites during the day, never before bed, and especially avoid dried mango as it is even more concentrated. Always pair it with protein or fat, such as nuts or cheese, to slow sugar absorption. Most importantly, if you are on any heart or blood pressure prescriptions, talk to your doctor first. Having explored these 6 surprising fruits, you might feel a degree of uncertainty about what truly remains safe, and that is a perfectly natural reaction. Recognizing these potential risks is the essential first step towards safeguarding your brain and heart for the years ahead. As we mature, even once healthy habits warrant reevaluation, as fruits that previously benefited us may now quietly work against us, particularly when combined with medications or eaten at inappropriate times. This message is not about inciting fear, but about fostering vital awareness. You certainly don't need to eliminate fruit entirely from your diet. Rather, you must consume it wisely. Opt for smaller portions earlier in the day, pair them thoughtfully with protein or healthy fats, and always seek your doctor's informed guidance. Your brain, your heart, and your cherished independence are invaluable assets, truly worth protecting. If this video has inspired you to reconsider your dietary choices, please show your support by liking this video, subscribing to Health 365, and leaving a comment below with the word "aware" to affirm your commitment to taking proactive steps for your well-being. Remember, you have navigated this far in life with immense strength and wisdom. Now is the opportune time to make the most informed choices for your health.